Well, in Module 2, we will talk about the basic concept of epidemiology and the 5 main principles that guide health promotion, the 10 essential functions that support the core services of public health, and why public health is often linked to legal and regular systems. In the end, we will talk a little bit about the emerging physical activity specialization in public health. So, first, what is epidemiology and how does it advance public health? Epidemiology, according to Last in 1988, it refers to the study of distribution and the determinants of disease and disability in populations, and is a basic science of public health. Epidemiologists are most interested in the defined population and how a disease or disability affects that population. Like, what causes the spread, how can it be prevented, how many people are affected, how type of people or what organisms are possibly affected more than others, who is at risk, how many could be affected in the future. These are all questions that epidemiologists are trained to answer, and the results can be applied to public health decision-making and policy development. When it comes to physical activity epidemiology, it also consists of the 2 parts. The first part is physical activity epidemiology studies the association of physical activity as a health-related behavior with disease and other health outcomes, the distributions of physical activity behavior, or the correlates and determinants of physical activity behavior, as well as the interrelationship of physical activity behavior with other behaviors, such as eating behavior. Second, physical activity epidemiology applies that knowledge to prevent and control the disease and promotion of the health. So that is a definition for physical activity epidemiology. And this is one of the major parts we will cover in this course. Well, who principles of health promotion? Essentially, there are 5 major components here. First, empowerment and inclusion. Health promotion should empower all individuals and communities to take some responsibility for the influences on their personal health. Second, intersectoral collaboration. Health promotion programs should be directed at all the relevant health determinants or correlates, and therefore should include all relevant collaborations among agencies and sectors. Number 3, multidimensional. The health promotion initiatives should use all tools possible to minimize health hazard and promote positive health. Number 4, participatory. The health promotion programs should strive to be inclusive at all steps and seek to maximum participation individually and collectively. And lastly, advocacy. All people with an interest in health, including the healthcare professionals, should take responsibility for the health promotion. So those are the 5 components or 5 principles of health promotion. In this slide, we will talk about the 10 core functions of public health. Those 10 core functions are listed in the figure as we can see here. Basically, the 10 functions are broken down into 3 parts: the assessment, policy and development, and the assurance. As we can see here, from assessment, this is a cycle. Assessment to policy and development, then to assurance, and then come back to assessment. the 10 core functions are meant to interact in a circle to maximize the public health. Number 1, phase, the assessment phase, begins the cycle with the monitoring of health and diagnosis and investigation of important or emerging health problems. So in the field of physical activity and health, so we will monitor the physical activity behavior and some health outcomes. Number 2, policy and development. Policy development ensures, including informing education, empowering people with regard to health risks, mobilizing partnership to deal with those health risks, and developing policies to minimize threats and promote health. In the third phase, during the assurance phase, laws and regulations are created and enforced, linkages to care are created, a competent workforce is developed, and effectiveness is evaluated. The cycle can then begin anew with ongoing monitoring. Importantly, this cycle revolves around research advances and administrative skills. Here, can you think of a specific public health problem like physical inactivity or sedentary behavior and apply the steps to each of these 10 functions? Think about this. If we apply physical inactivity in this case, what are 10 functions we should focus on following this cycle? Alright, so next we would cover the public health law. Many times the best strategy for making meaningful change in public health is through the legal system, regulatory system, or both. For example, the immunization laws for children prevent many early disease and deaths. The regulation on cigarette use in public places can be really helpful. In many places on campus, you are not allowed to smoke in the lab, in the library, in the office. Otherwise, it's against the university policy. Also, the motorcycle helmet laws can help to reduce the traumatic brain injury. Even these days, when you ride a bicycle, you are required to wear a helmet to protect your brain or head damage. Well, can anyone give us an example in promoting physical activity in the Twin Cities? I think, when you see the news on website or on TV, the Twin Cities rank really high in terms of fitness and health. In fact, it ranks number 3 or number 5 in the country in terms of fitness and health. One example here is bicycle lanes. As you can see, there are many bicycle lanes available on campus or near the road. However, in many other states, like in the state of Louisiana, where I took my PhD degree, the bicycle lanes are very few. Sometimes it's really risky to ride a bicycle on the road because you always share the road with the cars and without any bicycle lane signs. Fortunately, in the Twin Cities, in Minneapolis and St. Paul, we have many bicycle lanes, and I believe that is a result of the public health law. Not long ago, a new area of specialization named public health law emerged. The profession searched to leverage legal and government authority to promote and protect the health. Well then, how can policy development support public health? There are many possible answers, but here is one example. In the field of physical activity and public health, the effects of policies and program administrations are emerging knowledge base. For example, the school children are required to take 30 minutes physical education classes per day in some states. So that is required by the state law. Okay, as addressed in the last part of the textbook that we use for this course, policies for providing places to be physically active are showing promising results for the promotion of physical activity. Expertise in health administration and policy is critical for the implementation and evaluation of such effort. Well, here are the 3 response questions for Module 2. The first one is regarding the definitions for epidemiology and physical activity epidemiology. Second, how can policy development support public health? And third, why do you think physical activity is a new and emerging area for specialization in public health?